Hi, everybody, and welcome to Occupational Therapy 226, OT in Pediatrics. Today's topic is about theories, practice models, and frames of reference in pediatric occupational therapy. This is a three-part video, and my name is Melisa Kaye. I'll be your instructor. Let's go ahead and get started. All right, so we have three objectives for today. The first is to explain how theories, models, and frames of reference inform practice. So how do they connect? The second is to identify how these theories, models, and frames of reference may be used to augment intervention. And the third is to practice applying the theories, models, and frames of reference to client scenarios. Before we move forward, it's important to differentiate between those three terms. So here are some definitions, and they're important for you to know. A theory explains or describes natural phenomena and relationships observed. So a theory is kind of a big construct. A model explains occupational performance across the age span and across diagnoses. So if you think of it like a funnel, the theory is the biggest, the model is in between, and then we have frames of reference, which are focused on specific segments of occupational performance with a specific population. So we're going to go through it that way, but do keep in mind the differences. To start with, we have developmental theorists, and you'll be familiar with some, if not all of these. They're from two different kinds of categories. One is stage, which stage theorists describe a phenomenon as a progression, right? So you go through different stages. Interactional theorists describe a phenomenon as a product of various factors. So different kinds of factors come into play and create an interactional theory. So some stage theorists are Erikson, Piaget, Kohlberg, and Havigurst, and we'll talk a little bit about them. And the interactional guys are Vygotsky, Bronfenbrenner, Ainsworth, and Bowlby, and we'll also be talking about them. Let's start with the developmental theorists. Here they are, spelled out. And you have been through all of this earlier on in your OT career, and possibly as an undergrad, maybe in a psychology class or a child development class. So you should be familiar with this information. And if you're not, it'd be a good idea to review it. We're going to go super briefly through it. Erikson talks about personal social crises that promote growth, and I have some slides that will help you out with that. So he followed Freud, if you'll recall, and he looked at different stages of development and linked them up with these crises that an individual has to overcome in order to move to the next stage of development in a healthy manner. Piaget was all about cognition, and he too had some stages, which we'll be looking at. Kohlberg looked at moral development and how it occurs in a sequence throughout the lifespan. And interestingly, some people never get to a fully moral stage of mature development. And then Havigurst talked about different life skills that need to develop so that you have different levels of accomplishment. So his thing was accomplishments. I'm not going to go through this in detail, but it's there for your reference, both on the video and also on the slide deck, which will be uploaded for you on the learning management system. And you'll notice that there's different ages, different conflicts, so know these, please, different resolutions or virtues that come out of the conflicts, and an idea of like what happens if you get through this stage. Piaget looked at development in terms of four cognitive phases: sensory motor, pre-operational, concrete operational, and formal operations. And when you review this, and please do, it's not going to be the core of our work in this class, but I want you to have that foundation on which to build. So know the age ranges and know basically what happens during these various age ranges and why it's important. Kohlberg and moral development may be a little bit less familiar. He had 3 levels of moral development. Preconceptual, which you can see on the right side of your screen, happens before 9 years of age. And, it's really based on can I avoid getting in trouble and what's in it for me? So as you can see, it's kind of about how children are, right? How children are morally and ego-wise. They're all about me, right? So super self-centered. It's absolutely age and stage appropriate. And that's the first level. The second level is conventional morality. It's older children, teens, and most adults reach this phase. And it's about citizenship and law and order and collaborating and kind of those things that make a community or a civilization run. So review that in some detail. And then there's post-conceptual morality, which is the highest level. Rarely do teenagers reach this. And as I said earlier, some adults reach this phase, but not all. So this one is about an internal sense of integrity, justice, fairness, morality, if you will. And it arises from more internal forces, right? So rather than following the rules or obeying laws, one is acting from an internal sense of what's right or wrong, based on your own integrity and principles. And you can see in this one of the individual views is, I have the obligation to disobey unjust laws. So that's a pretty heavy statement. And to follow commitment to myself, to follow the ones that are grounded in injustice and injustice, not injustice, and well-being. So consider Kohlberg and moral development. And finally, we have Havigurst. So he has 3 sources of developmental tasks. One is that those that arise from physical maturation, growing up. A second that arises from personal values. And a third that arises from pressures from society. So you can see, this developmental task orientation kind of dovetails with Kohlberg a little bit and his moral development. Okay, so I have a couple exercises for you to help you review and make sense of these theorists. And the first one is about Kohlberg and thinking about which examples fit with which stages of Kohlberg's moral development. So if you want some more practice and you want to be able to apply this information, go back to the Kohlberg slide, maybe even go online and look up some information about Kohlberg and answer these 3 questions. You can, if you don't know or you want to review them, we can do that in class. There's no formal place for you to record your answers, but if you want to use this information, which is pretty much how the exam is going to go, you would be time well spent by looking at the review exercises. All right, so the second one, all of that being said, is to identify specific developmental accomplishments of infants and toddlers, middle childhood, and adolescent. So look through what he says about physical maturation, personal values, and pressures from society. And the final thing that I would like for you to do is to consider this case scenario. So there's a 4-year-old. He was born 8 weeks premature. So in other words, 2 months premature. That's significant. He's seeing OT for fine and gross motor delays. and his cognition and communication are within normal limits, or WNL. Question 1. What stage of Erikson's developmental progression is he in, and how might this affect treatment? Number 2, Piaget's stage, and how would this affect your choice of activity, and what might be an effective fine motor activity and effective gross motor activity? And then 3, what Kohlberg stage, and how would this affect treatment? So for these prep for class, which are in a different color, I would like for you to consider this, jot some notes down. We will be looking at it in class, and the expectation is that you'll be prepared to discuss it. That brings us to the end of the first segment of this 3-part lecture. I'll see you in part 2.